Many women today think that if they have acne on their face or facial hair, or if they have irregular periods, they have something called PCOS or PCOD. They're directly going to the doctors and telling, hey doctor, I have PCOS, can you treat me? Is this even true? And also, what is the difference between PCO, PCOS and PCOD? Will PCOS affect the fertility in a female? Will PCOS impact the fertility? Is IVF technique required for couples in where female partners are going through PCOS? There are lots of myths and there is lots of broken information. I'm going to tell you what actually it is and what should we do about it. This podcast is going to be really insightful. Please watch this podcast till the end. If you are someone who is going through this condition, or if you know someone who are going through condition, please do share with them. We are talking about real insights which are not commonly available on internet, where misinformation is spread massively. PCOS has become very, very common, and so many women are facing the brunt of it. Even they're single, or they're planning for the family, or even they have kids. So today, just like we break myths about everything related to fertility and fertility health, we're happy to have you, Dr. Sunil ji, today with us.
Thank you, Rohit.
Today, would love to go in deep about the concept of PCOS. What is the root causes of it? Can we reverse it? And will it impact fertility? So many interesting questions people have asked. So, would love to know the candid answers from you.
Sure, as always. So, this is again a very, nice topic for me, because I like to talk about this, considering there's so much of, misconception about this whole, topic. Even in the medical fraternity, I'll tell you, we still are, grappling with the usage of this term, whether we call it as PCO, I call it PCOS, or we call it as PCOD. When do we call them, or when do you really say, okay, it's pathological? So there are lots of things. Would be happy to talk about it.
Super excited. So first question, many people might not even know what actually is PCOS or PCOD. Or is there any difference between both of them? Like you said, when do we call PCOD or PCO or PCOS? Firstly, what is this condition? If you can explain a lot of common folks who are watching this podcast, it will be really helpful. Then would love to go in deep into what causes it and what treatment should we go.
So first thing is, I will go straight away to how the egg development and release happens and how is it.
So model if you want.
Yeah. That's okay. So see, generally when we talk about women's reproductive life, so once she reaches the menarche, and menarche is the first time a girl gets a period. Yeah. After that, it takes maybe 2 or 3 years for her to set a regular rhythm or a flow where she'll be getting a regular periods. Till then, we don't really worry much. But then, yes. So what happens in each cycle, there are a certain number of eggs which are destined to develop and release. So usually, there is around 60 to 100 follicles which develop each cycle. Right. But there's only one follicle which will mature and get released. And once it releases, then the normal periods happens after 14 days of egg release. So there are two cycles which we always talk about. One is the ovarian cycle, other one is the uterine cycle. Okay. So ovary has its own phase, eggs develop, release, and if the pregnancy happens, that released egg will become corpus luteum. If no pregnancy happens, then the corpus luteum goes down, and the hormones, initially there is only estrogen, and once the egg release happens, it's a progesterone. Even the uterus is the same thing, depending upon this cyclicity, estrogen primed first. First, the uterus needs to be primed with the estrogen, and once the estrogen reaches one peak level, as the egg releases, then the progesterone starts priming the uterine lining. And once the the lifespan of the corpus luteum or the released follicles, leftover cells are there, it gets over, then the progesterone is withdrawn. Once the progesterone is withdrawn, she gets a period. So this is the normal sequence of events. Certain number of eggs need to develop, but only 1 or 2 eggs will develop. And then if pregnancy happens, well and good. If not, then they get a normal regular cycle. But in PCO, what happens is, eggs, the follicles, develop to certain level, but they're not able to reach to the level of maturity. As I said, there is usually 60 to 100 follicles which develop every cycle. So there will be this 10 to 12 follicles will start accumulating in and around the ovary at a very small, or what we call it as a range of between 6 to 10 mm kind of a size. It's usually less than 10 mm size, and they accumulate in that. The first misconception is when we call it as polycystic. People think there is a cyst or a water-filled cavity. So the polycyst actually is a misnomer here, because that small cysts of bubbles which are there are actually the immature follicle, which probably if we had given a proper hormones would have matured to become a good egg and release. So these small bubbles are what is termed as polycystic or cystic. It is not actually a water-filled cavity, which generally every terminology is like, where for a general layman, if it's a cyst, is a large fluid-filled cavity. So it's not a cyst, it's just the follicles which have not matured. That was the first thing. The next is, as these eggs don't develop properly, they sit accumulated in the ovaries, and what happens, there is something called as auto degeneration of the follicles also. If they don't mature or they don't become the normal follicle to release, some of these follicles will get degenerated, and they will be absorbed by the body itself. So the ovaries, because of the number of follicles which are sitting in the ovaries, so many, the size of the ovary generally looks bigger. So that's why we have this terminology called as polycystic ovaries. Now that is what I'm trying to tell is, now we are only talking about polycystic ovary. A large ovary with many follicles, technically speaking, there should be more than 10 follicles at any given time when we see. But considering our scan machines are so good now, we have again upgraded to telling that, okay, more than 15 follicles, because even a small follicle will be able to pick up. A large ovary with more than 15 follicles at any given time when we see, then we call it as a polycystic ovaries. Now, when do we call it as polycystic disease or a syndrome? So both are actually interchangeable use. I do not want to, public to understand, oh, there is something called a syndrome or there is something called a disease. It's just the spectrum. So some people like to call it as a syndrome, some people call it as a disease. See, it will be very, derogatory if I say you have a polycystic ovarian disease. Right. So rather than calling as polycystic ovarian syndrome, sounds a bit more subtle. So it may be still okay to lots of people to consider that as a syndrome than a disease, because it's not a disease as such. It's just the little bit of hormonal play which is causing the problem. So when the ovary is big, number of follicles are more, and along with that, if the patient has irregular cycles means at least 2 to 3 cycles in a year should be irregular. In term, more than 35 to 40 days. It should not be that once in a year or twice in a year. It can still happen. There are many reasons where your cycles can become delayed or irregular. But if it consistently happens more than 2 times, your cycles are becoming irregular, more than 45 days your periods have not come, then that is one criteria. Next is there should be some kind of androgenic changes. When you talk about androgenic changes, there are some male pattern hair growth which is happening there, facial hair, thick hairs they're getting, and it is very, and even the facials are not coming out kind of thing. Then acne, bad acne vulgaris on the face and also on the back and hands, that one, and some amount of hair fall, which is also quite commonly seen, and voice change. Another sign is where you have a blackish discoloration around the neck. That we call it as acanthosis. And also same kind of discoloration, they'll have it on the armpit and under the breast. So if there is ovarian enlargement, along with that, if there is androgenic symptoms plus irregular cycle, then only we call this as polycystic ovarian syndrome. Otherwise, it is not a polycystic ovarian syndrome. Your ovary may be larger, but it is not syndrome. If your cycles are regular, if you do not have any androgenic symptoms, but your ovary is still large, you are still not a polycystic ovarian syndrome. Still S is missing for you. You are only polycystic ovary. Yes, there can be some kind of a life changes, things can happen, and then your cycles may become irregular. Yeah, we also tell that patient who have a polycystic ovary, you have a tendency to become syndromic. So better be sure that your lifestyle is under check, and you make sure you don't eat too much of junk food and exercise regularly, all those things. So this is the main difference between polycystic ovaries and polycystic ovarian syndrome.
And PCOD and PCOS can be used interchangeably.
Interchangeable. We generally prefer to use PCOS because we do not want to call it as a disease. Disease is generally very, sometimes it's very, derogatory. So we don't want to call it as a disease. Yes.
I met a gynecologist. She has an experience of 40 plus years. She is little until she has seen generations.
Of course, yeah.
She says earlier I used to see PCOS in women mid-age or pre-menopause. Now 1 out of 5 women, especially young teenagers, it's become very, very common. So what changed in these generations? Like what is the root cause because of many women are facing this challenge?
Ravi, I need to draw a line here in sense that when we talk about PCOS in an adolescence, it's a totally different topic. It's totally different thing. We never bluntly go and say, okay, any young girl less than 21, 23 years of age with little bit of irregular cycle that you have a polycystic ovaries or a polycystic ovarian disease, because it's a different way of managing things. Because even there are lots of societies, the educational societies which been still debating on, do we still have to label a young woman or adolescents particularly as a polycystic ovarian condition? So that's a totally different thing. So let's come to the topic where young women, we are still seeing polycystic. What has happened? What shift has happened? Girls are attaining menarche earlier. Yes. So we used to, when we were studying, anyone who attained menarche before 11 years, we used to call it as early menarche. Now our definition has changed up to 9 years. So this could be because of environmental changes and the food and whatever is happening. Next is, we have also seen that this polycystic condition, there are 2 types. We call it as a lean PCO and a obese PCO. Now, so when you talk about lean PCO is more of a genetically, something's gone wrong, where the hormone like FSH, LH, which actually regulates the egg development and release. So what happens is, initial few days till the egg really matures, FSH is high in the body. Then when the egg is nice and mature, LH starts rising. But in a polycystic ovarian condition, LH is higher. From the baseline day second or day third of a period itself, LH is higher. So that is the problem in the polycystic ovaries. Whereas when it is a genetic, it is nothing to do with your diet, your junks and things like that. But there is a big segment of people, almost we would say around 75 to 80% of the women who are on the obese PCO side. Now, you may not be, there are sometimes I'm not that fat also. Because you don't typically fit into obese. But if your lifestyle habits are not that good and you're eating too much of junk, lack of exercise, stress. Thing is, in young girls we see probably because of, again, the eating habits and also the stress of studies and whatnot which is there. So, and very, very sedentary kind of life. So that puts on the, stress on the system. Yeah. So when the stress levels are more, LH generally is more, or LH is secreted more than a FSH. So that causes the shift in the system. As I said, the whole generation has changed into now where we have defined menarche is also. Similarly, our polycystic ovarian condition has shifted to starting from a young woman. Yes.
There are quite some studies which says that you talked about puberty getting started at a very early age. Earlier, 12, 13, 14 used to be very common. Now, we're seeing 7, 8 year young.
Correct.
And there is a big role of endocrine disrupting chemicals.
Correct.
In the same way as what many studies are
Correct.
saying. These chemicals are very similar to human hormones, and body tend to
Respond to them like that.
respond to them like that. Do you think PCOS, from whatever you mentioned, looks like it's hormonal in nature?
Yes.
So do you think the increase of PCOS, the endocrine disrupting chemicals, like
course.
single-use plastics, they do play major?
Yes. More processed foods. Should not mention, but then there are high glycemic foods, colas, dairy food, dairy. Because basically more of high glycemic foods. We've seen any small school trip also, you see, first the kid will ask like, I'll have Coke, I'll have Pepsi, I'll have this. And many studies have shown that they contain very high levels of glucose and caffeine and things like that, which can again be a reason for your disruptive mechanism. And many times it's the plastics, nanoparticles which are there. What exactly is causing the shift? We cannot put our fingers, but we know that generally what is happening. Generally, these are the things which are the reasons. Yes. Another thing, Ravi, which we have seen is the amount of the way this condition is diagnosed. It's very heartening to say, being in this medical field, that almost like 60 to 70% of the time, when a girl comes or a woman comes and says, I have a polycystic ovarian condition, that's another thing, that most of the women, if they have any kind of a problem in this cyclicity, or if they're not able to continue, first thing they come and tell us that, sir, when I ask her, what's your problem? I have polycystic ovarian disease, I have PCOS, I have PCOD. I did not ask that. I don't want your diagnosis. I want your condition. What is your problem? Why did you come to us? I will tell you whether you have PCO or not. So that's something which they should take out of their mind, that once you're told PCO, that's why we said we do not want to delve into the adolescence age, because once you tell the child that you have a PCO, that will continue towards her adulthood and whatever. Next is, almost 60 to 70% of the time, we have seen this diagnosis is wrong. In sense, as I said, three things which are very, very essential: polycystic ovaries, androgen symptoms, irregular cycles. Every scan, invariably, whenever they do an abdominal scan, we insist on getting a transvaginal scan. Anyone who is sexually active. Who is not active, then there are other ways of looking at the ovaries very closely. Invariably, anyone who is going with an irregular cycle is diagnosed as polycystic ovaries. And polycystic ovarian syndrome is just like that diagnosed. Yesterday we had one patient. This is very discomforting again. Patient is only around 26-year-old and married for 4 years. Did not want to conceive for first 2 years, and now past 2 years she is trying to conceive. Cycles are a bit irregular. Patient is little bit on the overweight side. I would not say on the obese side. She's gone to one of the consultants. Scan done. Scan says polycystic ovaries. Okay. Now, what did I say? Ovary size should be larger and you should have multiple follicles. When you look at the size of the ovary, it is written very clearly, it is written 2.8 into 2.1 into 1.6. When we calculate, the volume is coming only around 4.8 cc. The textbook definition of a large ovary is, volume of the ovary should be more than 10 cc. Now, your ovarian volume is already on the lesser side. So now when you have been printed as a report as PCO, she goes to the consultant, gynecologist, she sees the reports that okay, it's a policy, and you are put on oral contraceptive pills for 3 months. Because oral contraceptive pills is one of the methods of treatment for PCO. We will come to the treatment aspect. And then now, after that, now she comes to get the fertility treatment, and 1 or 2 cycles of ovulation induction has happened. She has not got any follicles which have developed and released. So she has been diagnosed to tell us that this is a resistant polycystic ovarian condition. So she came for the second opinion. So we did the scan, we did a transvaginal scan. As I said, she is married and having a regular sexual life. We find that the ovary is the same size, 2.8, 2.1, and what the volume is less, but there are no eggs. There are less number of eggs. And then we run an AMH test. AMH comes as 0.5. This is quite a common scene which we get when we get a second opinion, that any woman with an irregular cycle has just been labeled as a polycystic ovaries, and they go on with the treatment, and then we know that, and there is a day where they come to and say there are no eggs, and then so probably I took a treatment, that's why no eggs. No, it's not like that. It's actually low egg, which has been diagnosed wrongly as a PCO, and then you've been carrying on it. If the ultrasound says polycystic, I would request most of our viewers to go ahead and do certain blood tests to prove it, because scan may be right or wrong, but to be sure, you need to be doubly sure that what you are dealing with. Get a AMH done.
Right.
Last few sessions we are telling don't do repeated AMH, but I am telling for this condition at least have one baseline AMH to say okay, your AMH is whichever range.
Right.
Because if in a polycystic ovarian condition, AMH is super high.
Yeah.
This also we have told, I think.
Right.
AMH is super high. But if you are in a low ovarian reserve and you've been diagnosed as a PCOS, I would rather take the treatment earlier. I would not put you on oral contraceptive pills. I'm wasting my time on you putting oral contraceptive pills. We can use as well go in for treatment for fertility. Yeah. So we have typically seen this whenever there is an outside scan report telling of polycystic ovary. This is also quite commonly happens when they come and say we have polycystic ovary, and then say okay, let's go for a scan. And then when we say it's an internal scan, look, no, they did an above scan. No, we said we insist it's an internal scan. If you're married, we do an internal scan. If you're sexually active, we do an internal scan. And to our surprise, most of the time outside diagnosis of PCO, whichever is done as a transabdominal scan is wrong.
That's
no, that's not interesting, scary. But then scary for us. Because when it comes to second opinion, it is scary to tell them that what others have diagnosed is wrong, and then then we would look like as if I have not got the diagnosis right. So the proof is in the pudding. Get a blood test done. I am not telling. If you don't believe me, get a AMH done. You don't want to do it in our lab, do it outside. Any lab, get the test and done and come and show it to us. We'll tell you. So, transvaginal scan becomes a very, very important part of diagnosis when it comes to polycystic ovary syndrome or a disease. In an adolescence, that's the reason we only treat the symptoms. We do not put a diagnosis there and telling that, oh, you are a polycystic ovarian kid, you are a polycystic ovarian syndrome, and then, it's a stigma which you need to carry all throughout your life. So we would say, okay, your cycles are irregular, okay, you can do this. If you are putting on weight, you could do this. If this is this, you can do that. Rather than, giving a diagnosis which has no meaning for them.
True. I think that's very insightful. It could really save a lot of diagnosis not going in the right direction. And these three things are very empowering, like you said. One, you check the volume of the ovary and see if the follicles are present there. And two, you mentioned about androgenic factors where you have some facial hair or acne. And three, irregularity in periods.
Irregularity, yes.
Are there, then you can...
So there are certain variants in place where they have polycystic ovaries and only irregular cycles, no androgenic symptoms.
Right.
Some people have polycystic ovaries and only the androgen symptoms. Some people do not have polycystic ovaries, but they have androgenic as well as irregular cycles. You need to do a proper thorough evaluation before putting a thappa कहते हैं ना, thappa एक बार you get sealed, then it's sealed forever. Everyone wants to tell it is polycystic ovary because it's easier to tell that.
So overexposure of this information also have a downside.
Yes.
People themselves come and say कि we have PCOS.
Yes. Yes.
Yeah.
Yes,
Yeah.
because I keep telling this to my patient. You don't tell me you have polycystic.
Right.
Don't even tell that you have polycystic. Why do you want to tell that?
Right. I think it's a very fair point that you mentioned. If periods are irregular, every woman today thinking that I have PCOS or...
See Ravi, I'll tell you why very simplest reason why cycles the women can miss a cycle. Flu.
Yeah.
She had a flu during her early cycles of her period. You have taken 2-3 doses of paracetamol, maybe sometimes people even take diclofenac and that will upset the ovarian cycle. So you may not ovulate. If you don't ovulate, then your cycles are missed that cycle and you come back after 40-45 days. Then flu in Bangalore, though, it's like, or in any country, any part is like every third month it's changing. So every third month or fourth month you may catch a flu and then you will have irregular cycles and say, oh, I have irregular cycles, so I have PCO.
Yeah.
That's not the diagnosis.
Right,
Nah?
right.
So you need to pragmatically analyze why you missed your periods. Most of the kids during their exam time, I'll tell you now, December is starting, na?
Yeah.
Now by March we'll start getting, iska cycle nahi aaya, this is not there, she's eating unhealthy and all those things. It's a stress.
It's a stress.
It's a stress. So you, rather than labeling someone as one condition, just give a regularity, whatever treatment which is necessary and say this happens, it regularly happens, don't bother.
Many female colleagues also tell like in the months which stressful
Yeah.
things are there, some targets or some things need to be achieved. They clearly say like we know that we're going to get the delayed periods usually
Sure.
or painful periods during the time. Something they'll notice when during the
Correct.
stressful months is what we also commonly hear.
Correct. Yeah.
Thank you for this breaking very important myth. Now coming to the relation between PCOS and fertility. Many people think that if there is PCOS, the chance of miscarriage is higher, or in certain cases, IVF is needed to be done. So, what is your take? Like, what is the relationship between PCOS and fertility, and will it improve the chances of, let's say, going for a miscarriage, or the likelihood of requirement an IVF for treatment as a treatment?
So I'll answer in part by part. This is first is fertility.
Right.
As we have already talked about the physiology or the function of the PCO, eggs don't develop well. Okay.
Right.
If there's no egg which is there, then there's no fertility, pregnancy which happens. So that is the main reason for not conceiving in this category of women. We have seen even women coming, we've been trying for 3-4 years but still not conceived. Your cycles are irregular. You have polycystic ovaries. So most of the time there's anovulation. That means no egg which is released. So very unlikely that they can conceive. Unless we get her ovarian cycle regularized, she may not conceive. So it's very simple also. We will talk about the simple treatments. So if they start generating follicles, if the follicles become mature and release, they're most likely going to conceive. We've seen that there's a very simple drug which we give for what we call it as ovulation induction. Here the eggs develop better. There is a shift in the hormones like FSH, LH. Things change, so FSH becomes more and LH is reduced. So in that way, the egg starts developing and they conceive. So almost like when we say if we give this treatment, almost 60 to 80% of the women will ovulate and almost 50 to 60% of them will conceive by the end of 6 months. That's a good rate. It's a normal comparable rate and whatever scenario you think. Yes. Yes. Very less intervention. There are many different ways of treatment also. PCO, we'll talk about that. Next is, are this PCO women increased risk of having miscarriage? So there is a separate segment of this PCO again, women, where we can say, okay, in this woman, there is more likelihood of miscarriage. One is people who are on overweight side, obese, generally they will also have a PCOS, also have some amount of glycemic disorder like diabetes, the starting of diabetes and things like that. They will also have some amount of cardiovascular problems or dyslipidemia as we call. So when these things are there, then there is a more likelihood of miscarriages.
Right.
Also there is one more sect of patient where the LH levels are really very high. In that case also implantation failure is more, and also early miscarriages. Very early miscarriages are quite common with women who have a very high level of LH. Yes, this can also be treated very simply. When I'm talking about the simple treatment, let's go to the simple treatment now. As I said, there are two types of polycystic. One is a genetic and one is a obese or lean and non-lean. Okay, so when you talk about lean, we may not be able to do much as far as the the simple treatment is concerned. We generally give them ovulation induction medicines, and they generally respond really very well. Next comes the obese. Obese PCO, we know that it is more related to their lifestyle and is more related to the the food, exercise and diet. So what generally our book says is, if this the obese PCO women loses 5% of their weight, almost 50% of the women will start getting a regular egg development and release.
Wow, that's a very powerful stat that you have quoted.
It is very powerful, but understand it is so difficult for us to convince these patients to lose that 5%. I mean, imagine 5%. How much are we asking? 100 kg, 5 kg loss. 80 kg, 4 kg loss. This is what we generally see this usually in the range of 70 to 100. Generally less than that usually are quite okay to lose, but even 5% loss, 50% will have a normal ovulation and pregnancy. You are saving so much of your resource wasted into the treatment of medicines and things like that, hormones. So if you can lose weight, then it's fine. How I tell them is, if you can lose this much weight, it's fine. Otherwise, I know how to make the eggs develop. I can give you tablets first. If you don't respond to tablets, then we may have to give you injections. If you don't respond to injections, we may have to do a surgery. If you don't respond to that, you may have to do an IVF. Do you want to go through this? Put 1 month or 2 months of an effort and you will lose your 5%.
But I should say doctors like you are also very rare. Like who are saying 1, 2, 3, 4, these 4 levels of explanation. But through this medium, at least many people got to know.
Most of them tell, because I think we have more time to insist. We may tell, because there are busy consultants who may not tell you also, fellow, chalo, theek hai, polycystic hai, tablet diya, hoga. But the ideal approach is first change in the lifestyle.
Yeah.
Ideal approach to PCO condition is understand their lifestyle, understand their stress level, treat the stress level and their, the lifestyle. It hardly takes a month or two to, fix most of it. As I said, it is only 5%. 5% losing weight over a period of, for you 5 weeks, but then I'm telling 8 to 10 weeks is still good enough. So 8 to 10 weeks, you are fixed. Rather than, going through all the circles of, medicines, investigations and treatment, just 10 weeks, just have a determination that no, I'm going to be there. Yes, I told 50% of them. Another 50% may need some kind of a help. And if you have lost that 5 to 10%, your response is way better than what you were before. So yes, success rate is really good. Now, there is a segment of patient, in spite of all these things, would require IVF. In sense, if ovulation is good, lining is good, if everything is coming up well and still you are not conceiving, then that is not a typical reason. I would not say is polycystic is a reason for infertility. It probably there is some other added factors or unknown factors, what we call it as unexplained infertility. So that could be the reason where you may still require to go for an IVF. What we have seen in our practice is almost 60 to 70% of women with polycystic do conceive very simply with this lifestyle changes and yoga and exercise and diet, and with certain small help with the medications. 25-30% of them would still go on to require a IVF treatment. If you look at the normal incidence of unexplained infertility going on to IVF is almost 30-40%. So it's still the same comparable reason, because you cannot say there cannot be two reasons existing in a couple who are not able to conceive. So there can always be. So yeah.
Right. So just because of PCO, there is no need to go till IVF.
No.
Say that.
Yes. Just because you have PCO, directly going for IVF is not an answer.
Right.
If you have already tried your all treatment, as I said, if your egg development release is good, you are still not able to conceive after your certain amount of time of treatment, then probably yes. Because there could be an added component of unexplained infertility or some amount of problem.
But that
there.
infertility is not induced by PCOS in this case.
If you all see, I told you the main reason for not conceiving in PCO is the egg which is not developing. Now, when your egg is developing, releasing, lining is good, your hormones are good, you're back to your normal weight, then you still say polycystic is the reason for not conceiving. It's a little bit tricky. No, I don't think so.
Very, very clear, sir. There's a lot of advice on internet that weight loss can cure PCOS. Is it oversimplification or it is actually true? I mean, you have given a very fair explanation, but I just want specific about weight loss on this point.
Now, when we say cure about PCO, this is something which I think, talked on a few platforms again. There's nothing called as cure for PCO. PCOS, we have already told. PCOS is your cycles are irregular, hormone imbalance, that can be cleared. If you lose weight, you fixed your diet, you fixed your lifestyle, most of the time. Other than those lean PCO who have, unfortunately, because of the genetically, they are in the fix there. So, as the number of follicles are more, and also there is something called as cortex. There is a thick cortex or stroma in these people. As the age goes on, the number of eggs and the natural process of degeneration which goes on, generally by age of 35, 38, their cycles automatically become normal. That's when your polycystic is kind of a disease or a thing is gone. But for some women, it may still continue to function in a hyper, response kind of a stage. But there is no particular cure for this, because as I said, it is not a disease, it's just a syndrome. You fix few things, your cycles are regular, your periods are regular. Do not take too much of stress about ovaries being larger. If you can control your lifestyle, then this ovary being larger will still function normally for you. Then there is no polycystic ovarian syndrome or a disease. So you should not be unduly worried, that, oh, my ovaries are larger, that's why I'm in this condition. No, it's the other way. Because you put on weight, because of your lifestyle, the ovarian, which was larger, has now tilted towards being abnormal function. You correct your lifestyle, your ovaries will start functioning normally. Then people ask, what is the solution for my polycystic ovarian syndrome? My question is, what do you want at this stage of your life? If you fixed your, lifestyle condition, everything done, and still your cycles are not come back to normal, or you're still worried about your polycystic ovarian morphology, what do you really want in this stage of your life? If you want fertility, we'll treat your fertility problem. If you want regularity, we can give you some medication for regularity or advice for how to make things regular. Do not go to micro level of thinking, how do I fix my ovaries to become normal? That cannot happen. That can happen surgically. Now we can go and do what is called as a drilling or a wedge resection or cut off half of the ovaries and remove it, and then probably it will be fixed. But do you want that? Why do you want it? What do you want in this stage of your life? It's very simple. Corollary thing is, when you go to hotel to order, you just look at the menu and say, what do you want, right? You don't ask the thing telling which chef is there and what is he cooking. Like, or what kind of rice are you using? No, you're not. You just want your thing, right? You tell me, what do you want? You want fertility? Okay, this. You want regularity of period? This. Do not go into thinking, telling, my ovaries are larger, I need to fix that. No, you cannot fix it. Over a period of time, nature fixes itself. But then, now let's look at this. Now you want fertility, but you're telling, okay, my ovaries are larger, fix my ovaries which first, then I will go for fertility. Then I say, okay, come back at 38 years of age, I will tell you. No, that can't happen. Now you want fertility to also to happen. So fix your fertility problem. Ovaries will fall in place. Yeah.
For a lot of the couples coming to you to Ayurveda consultants to work on their lifestyle, etc. Have you seen them Ayurveda as a science helping couples to manage their PCO or PCOS?
Tremendously. In sense, Ayurveda, I would being a allopathic doctor.
Yeah, I mean, I'm sure you.
But then it's a part of the life, I'll tell you.
Right.
Ayurveda, in sense, what my consultant, which see, as I said, we may not be having so much of time to explain to you each and everything about diet, lifestyle, stress, and things like that. So basically, the lifestyle managers here, along with my Ayurvedic consultants, they look into the touch points as to what is your the difficulty in either exercising or the diet or the food, and what exactly in the food that you are doing wrong. So they look into micro things and they fix it. And that small fixes most of the time enough. And Ayurveda as such deals with toxins which are accumulated in the body. How do you cleanse it? How do you regularize things and sleep? All those things. So it helps in a long way in positive reinforcement of the patient.
True.
Without going on to very high dose of medicines and medications. They are more, I would say they are more, they listen more to my Ayurvedic doctor than me. Because if I say go, my way is blunt way, I say like tomorrow onwards start running 3 kilometers in 15 minutes, half an hour. But then Ayurvedic people take it through in a very subtle and a beautiful way where people are more amenable to this kind of treatment options, and they respond really well.
Right.
And most of the Ayurvedic treatment, I've seen that they don't put them on medicines and things like that. It's just the lifestyle and probably a little bit of
some detox,
some kind of exercise. I know that they also teach them certain yogas and exercises which brings in more metabolism and things. This is good.
True.
So I am a very big fan for this when it comes to polycystic kind of condition, because as we say, lifestyle changes will fix almost 50 to 60% of polycystic conditions. Yes.
That's very insightful, especially about the diagnosis and how people are self-diagnosing or misdiagnosed happening in some places. Thank you so much for breaking all the myths and being candid as usual. This is really, really valuable for everyone. I would say not only folks who are looking for fertility, health, etc., but for every woman out there. I mean, it's very, very common. 1-2 cycles they get delayed, and everybody labeling themselves as PCOS, PCOD, and very loosely how we use the word PCO, PCOS, and PCOD without even understanding what they are. So thank you so much for explaining it in so much depth in a very crisp way. Thank you so much, Dr. Sunil.
Thank you, Ravi. I would from this media, I would also want to tell, as I said, self-diagnosis.
Right.
Or we also say the social media or internet diagnosis. Now we have all that AI-driven system where you put your conditions and say, I have this, what's my diagnosis? And it may give you, but I'll tell you, the traditional way of diagnosis is the only way which can fix your issues. So, if I put some 10 symptoms, anyone can tell your some kind of a differential diagnosis, we say. Until unless you have been differentiated to have a proper diagnosis, you cannot go on with your differential diagnosis.
Right.
So please be more, responsible in sense of, don't take everything on, Insta or whatever your social media to be your
On the
doctor.
face value,
So,
yeah.
Meet a correct doctor and get your treatment and diagnosis.
Thank you so much. Lovely talking to you as always.
Thank you.
That's Dr. Sunil, whom we just spoke to. And he is not a big fan of IVF. Don't take us wrong. We have nothing against IVF, but we are not big fans of unnecessary IVF. If you are in Nama Bangalore, you might have seen one IVF center in every street, very next to your favorite Udupi breakfast joint. If you have been to one such center and you are recommended IVF, just one question we want to ask you. Have you explored all of your options? Are you certain that this is the right treatment for you? If your answer is no, then please do visit IMAM's Fertility Center. Here we believe that IVF should be the complete last line of treatment, and there are so many things tapping the power of your lifestyle and so many other alternatives you can fulfill your dream of starting your family. At IMAM's Fertility Center, we don't tell you what you should do. We will tell you what your options are. What are the pros and cons of each option, and you take the decision for yourself, and we'll help you support with a healthy conception. That's what we believe, which is called informed decision making. For those of you who already did a lot of rounds of IVF centers, here is a small gift from our side to ease your discomfort. For all of you, those who have gone through lots of discomfort roaming around this IVF center, here is a small gift for you. Our first consultation, which is worth 14.99 rupees, will be offering it for you for just 1 rupee if you have been recommended IVF before from any center. So come visit us in JP Nagar, understand your options, and start your fertility journey with a lot of positivity. See you on the other side.